Hi, I'm Marissa Warning. I'm a student nurse at the University of South Alabama, and today we're going to be performing a soap suds enema. The first thing we're going to do is we're going to enter the patient's room. We're going to check the hospital policy and the patient care orders, and we're going to see that he should receive a soap suds enema on arrival to the floor. Then we're going to perform hand hygiene. We're going to check to make sure that this is our patient, Jaguar Jones, date of birth August the 25th of 1963, and they're allergic to penicillin. Then we're going to explain the procedure to the patient, and then we're going to provide privacy, and then we're going to provide hand hygiene again, put on our goggles and our clean gloves. And we're going to take our enema bag over to the sink. Clamp it first. We're going to fill it with 750 to 1,000 milliliters of water. After we add the warm water, we're going to add soap. Okay, and then we're going to close our bag, gently agitate. Okay. And we're going to prime our tubing. Okay, now that we've primed it, we're going to return to the patient's room, and I would place the enema bag on a hard surface. We're going to place it on my assistant's fingers as an IV pole. Then we're going to assist Miss Jones to left lateral sims after adjusting the bed to a working height and lowering a side rail. Then we're going to take in our non-dominant hand, we're going to take and hold the hip of the patient and tell them that during the procedure we're going to need them to take slow deep breaths, and if they had hemorrhoids they would need to bear down, and we would take the non-dominant hand to spread the buttocks. We're going to, with our dominant hand, we're going to lube and remove the cap. This is pre-lubed. And we're going to insert about 4 inches, and then I would then take the enema bag and hold it about 12 to 18 inches, and if there were any signs of cramping or anything like that, I would clamp the bag or lower the solution. We would normally unclamp it and allow the fluid to run through, but for this simulation we're not going to unclamp it. And then once the bag is empty, I will remove the tubing, put it back on my IV pool because it's still full, and then I would help assist the patient to the bedpan. This side is the side that would go under the buttocks, and I would lay the patient back down and tell them to hold the enema for 10 to 15 minutes, and then I would return to the nurse's station to document. We would document the amount, the type of enema. We would also document the time, the toleration of the patient, the color and the amount of the return, and how the patient was left after the procedure.